Now we're going to change it up back to something you and I have talked a lot about in the last couple of years. It's been interesting to hear about what's going on in the DSO business model.
Has your community changed because of the DSO model? I mean, I'm in Knoxville, Tennessee. You're in Greenville. We're in East Tennessee.
Yeah.
And I see has been a change because of the DSO model, right?
Yes.
And that's why we've got our next guest on the show, right?
So we'd like to welcome Dr. Hans-Peter Weber. Thank you for being with us.
Yes.
Thanks for having me.
Yeah, we're glad to talk to you. And this is, I remember when I heard that this is what we were going to be seeing from you, and I thought, oh, this is interesting. Because you've spoken on a lot of very clinical topics over the years. And yet now with AO, we're seeing today this very interesting discussion that's happening this afternoon about business and different business models and how that affects implant dentistry. Talk a little bit about yourself before we talk about that, get into that. Tell us who you are and what you do and where you are.
Yeah, thank you. I was born and raised in Switzerland and did my dental school training over there. Met a nice girl who at the end wanted to go back to the States, and I had a choice: do I stay home in Switzerland or do I come to the States? Had done a lot with Americans over there, and it was an easy move, except having to go back to dental school. That was the only thing. But we made out well, and I ended up at Harvard, which was great, and became department chair there. Needed a little fresh wind in 2010 and went to Tufts. They were searching, and their business model was a little different, a little more in my favor, with kids having to go to college. And then in 2018, I was, as a good old Swiss, more than retirement material. In Switzerland, everybody retires with 65, except some dentists who might work longer. And I was just not ready, and I thought I would go teach part-time and maybe practice 2 days. I was doing outside practice 1 day. And then I got a call from Steve Eckert, Dr. Eckert, who was the president of this group and had been with ClearChoice for a long time, DSO for a long time. And he said, would you be interested? I said, I never thought about it. And so I met the leadership, I met the colleagues. There's several good colleagues in here who were in academics or in hospital settings who had joined the DSO, and they were all happy with it. And most of them would say, but the greatest reward is the patient reward, because you have those patients with impossible, I didn't even know these exist, to the level of a number they existed in Massachusetts with destroyed dentitions, just never went to the dentist. And suddenly they have this life-changing moment and enlightening, and they see an ad of this DSO, and so maybe I go check it out.
And it brought joy to you, and at a time where you might be, somewhere else and not even practicing dentistry and still doing something you love.
Yeah, and the advantage has been that clearly a lot of the management is taken from my shoulders. I would not have been experienced enough to come from academics, where you have a support system in human resources, in legal. You don't have to care about those things. You manage your department, but to go into a private practice where you have to do everything on your own, be knowledgeable in all those aspects, it would have been a tough thing to do. So I could really focus on what I liked, is seeing patients.
Yes. Now, this idea of kind of being drawn into that because of the desire to help patients and do something exciting, and also had the connections with others that had done similar things. That's one way that people kind of become part of the DSO model. Another sometimes is through maybe wanting to transition out of their practice, or maybe partially, maybe again, take some of that pressure off of their shoulders. What do you think the future looks like for that in implant dentistry and maybe dentistry in general? Where are we headed with the DSO model?
I think it will go in the DSO direction more and more. I understand why the older generation, it could be me, if I had been for years in my private practice and now comes this DSO, I probably would be upset too. But we also have to say we will only be there for a few more years. And the young generation clearly goes that line. When you look at I just read among dentists below 35 years, only 1 in 4 is in solo practice. It's group practice or it's DSO. And when you look at the numbers, I think in 1999 it was 2 out of 3 were in solo practice. These are male dentists, and now it's 1 out of 2 in 2019.
So the days of the solo practitioner may be a bit numbered, somewhat.
I think they will not be totally numbered. There will always be these enthusiasts, let's call them, that who like to have their own job and they find the right environment. They'll provide for a group of patients. And there will be patients who always will like that model better.
Do you think that it'll happen more in the specialist realm first, or do you feel like that the days of the general practitioner being, as a sole practitioner, because for years, I mean, general practitioners practiced sole practitioner, and it was very rare to see group practices. But we've seen group practices in specialist organizations for years, and it seems like even in our own community, we're seeing some of these DSOs move in with the specialist.
Yeah, seems like that market. I mean, we know some of for instance, the oral surgery DSOs have become huge. There's huge numbers of practices that have joined up. Do you think the specialist market is moving faster?
I'm not so sure if it's on the prosthodontic side the same. I think I know now the surgeons, we have associated ourselves with a group of surgeons in Quincy. They provide our services, South Shore Oral Surgery. They just joined a DSO. And the owner, David Lasbader, is thrilled. He says all this administrative stuff is taken away. Now, it's very much his own practice. Characteristic hasn't changed. And I think there's so many different levels of DSO involvement.
Yes.
That it's a little bit hard to compare.
Right. You have the, sort of the independent DSO model where we have like a silent partner in the practice, and then we have I'm joining up with a business model that clearly I'm changing the name of my practice and it's becoming a copy of another office. It's very different.
And what attracted me to the DSO I'm in is when I started talking with them, there was a clear mission and a purpose. We want to get rid of dentures in the world. We want to give hope to patients who otherwise are lost. And I could clearly identify with that. And then all the background information came, how many dentures, periodontal disease. And I saw it live with all those patients who I thought, they all would be treated, but they just haven't gone to the dentist. And then obviously the general dentist is their go-to person, but the general dentist's ability is limited. I mean, and I think it's more limited than in the generations before. When I see or hear what older faculty members say, I made 80 crowns during my dental school. Well, I was made 7 at the end.
And that goes to this question.
Big difference.
This goes to this question. I mean, like even in my training, it was a lot of gold onlay work, and this transition into a different way of teaching dental students, and the number of reps we're even able to get in certain procedures. Is the DSO model a better model to take our graduates, right, and raise the level or the standard of care? Is that the answer?
It could be the answer if the DSO is a good DSO and does it the right way.
So what is a good DSO?
I would say our DSO is a great one because there's so much emphasis on best practices in clinic, in operation, and in culture. And there is seminars, we have doctors' meetings, staff has meetings. During COVID it was a little more difficult, but we had the convention still virtually. And the CEO is very much on top of making sure we have a good culture.
And I think that is, from the beginning, I think DSOs, the initial reaction from many dentists was, that's going to be bad for dentistry, or that this quality will be lower because it is
about quantity.
Because it's a corporate mentality. But that's not necessarily true.
No, but that's what I mean with a good DSO and the bad DSO. If they just put you on a financial target and nothing else, you might just be as lost as in a solo practice or practice with a colleague. But if it's a model like we have, there is clinical education, you have peers who have done it for a long time.
Yes.
And there's really a regional team, you talk to each other. I did this yesterday, I saw that yesterday, what would you do? So it's a great interaction.
Yeah. So Go ahead.
At a bigger scale, but the group practice would be the alternative to that. And I think for the general dentist, that job might be something. If you're in an initiative, general dentist with a good business savviness, you hire some the specialists around you. You can be the chief of the practice.
I think the thing that's frustrating for patients is this rotating door of clinicians in and out of DSOs in some realms, right?
Sometimes that can be a problem.
And that can be a problem. And really, who am I seeing today?
Yeah.
And that because dentistry is so personal, right, to the patient, especially in the hygiene realm.
Yeah.
And because it's almost like a hairstylist per se, not to to kind of compare. It's like to get
a relationship.
To get a relationship that's established, and then the next time you come, well, that's somebody else, right? What are DSOs, good DSOs, doing to retain, right, the clinicians, keep them from moving on?
Yeah, so I think culture is important. And I have a young associate, and I ask her, what would you say is negative or positive? And in her case, transparency came through as the main word, the transparent contract. I know that's what I get. And if I get promoted or go to the next level, that's what it will be. And she had experience in a couple of private practices before where this didn't happen. And so I think that's just the more professional, more the business attitude of a bigger group, of a corporation like that, where those areas are covered better.
Certainly, I think, too, dentists are trained technically proficient in dental school to come out and provide a certain level of care to the patient population. But one thing that's always lacked is business training.
Yeah, absolutely.
And, I started private practice from scratch. And the toils, right, that you go through in that. Is this the opportunity for a clinician to truly focus on being a clinician and educate? So speak to what DSOs are doing to provide even education for the technician.
So we have a centralized lab, and there's a conventional component, a digital component. And if we hire a new technician, that's probably was the most frequent rehire we had to do. And they are not easy to come by. They would go to Denver, to the headquarters, and in the central lab and get trained in the techniques they need to know, which are specific to what we do most of the time. And then there is consistent, continuous training also, either online or live or at the meetings where they are provided that information.
Right. So even for dentists, too, the doctors, are they giving a stipend to, in some situations, to go to meetings like the Academy of Osseointegration?
Yeah.
Yeah.
It comes out of my office. It's obviously my office.
Right.
And if I go over with my expenses, somebody will probably tell me you splurged a little too much.
Yes.
But we have sort of a certain maximum per year for meetings.
Sure.
And that's definitely a maximum covers.
One of the things that medicine, I think, has figured out is that they need to have accountability so that and collaboration. In dentistry for years, it was we had our own ship that we were commanding, and that if we went to meetings and we chose to show people our stuff, then we could be held accountable. But if we didn't want to show anybody our stuff, we kind of had our own little area, and we didn't really know how our successes or failures compared. It seems like one thing I'm seeing is that, as you're talking about, I'm showing people what I'm doing every day. We have collaboration. We have accountability. There is a certain standard that you're expected to keep. And though that might sound constraining, it's also a good thing. It sounds like if the standard is a good standard, is it possible that DSOs could elevate the standard of dentistry?
I think so. The good DSO. Again, who cares about that, and who has clinicians in it who are eager to improve too, who don't say, I don't care what they tell me, I just do it my way. And so I think for a younger dentist, it could be a great assistance to be in a system like that, to learn the trade of business too, of running a practice, and maybe 5 years later, open your own if you really want. I think by that time you probably realized all the advantages of being in that system that allows me to focus focus on what I really like to do, which is dentistry.
Yeah, and so many. I mean, just even in the past 2-3 years, I think people are they're thinking about really what they want to take home with them, right, every day. And like Dr. J. Malmquist said earlier, is that dentistry is a profession where really it blends over into the evening. It's beyond 8 hours, and it blends over into the weekend sometimes, and it can affect your spouse. And DSOs, a good DSO, right, could maybe be the answer to really job satisfaction.
Well, and I think DSOs have hit it at the right time, whether they knew it or not, with COVID. Yeah. COVID did an interesting thing to all of us, right?
Yes.
It caused us all
I admire all of you for how you get through that.
Yeah, whether it was the business losing money or whether it was I don't know that was as much the thing as we thought it might be, but it's just, I think it centered our minds many times on balance, and that's what a DSO can potentially provide, is more balance in your life.
And that's, I think, what the younger generation is looking for. And they also see, $500,000 in tuition bills to pay back.
Yes.
And then you want to open the practice, that's another $1 million. And then at the end, I work 24 hours, 24/7.
That's right.
And that's not what I want to do. And I might make more money, but I rather take a little less and have quality of life.
Right. Yeah. Cost of education definitely makes this an appealing thing, especially whenever payback comes into play. You work this long, we're going to pay this much of your loans. It's a sign-on bonus per se, and an agreement. And I think looking for the good DSOs, and I want you to give a couple characteristics, because you probably have some young listeners listening to this that haven't graduated yet. Give us the good DSO characteristics. Maybe just
what
a few
should they
highlights.
look for?
Yeah, that's a good question. I haven't thought about that. Definitely, what's an educational component? What's my mentor? Is there mentorship? Am I just put in on the financial target, and if I don't reach it, you dump me basically. So that I would like to see that educational component as an important one, where you grow. Hopefully there is a more senior person in that office where you can learn from and grow that way.
Mentorship, right? Education. So that you can grow.
Well, the interesting thing that we'll say, and this, I don't think we'll step on too many toes, but maybe a couple. There's been an interesting thing that we've seen, and this is not universal, but some of the older dentists, as they've been looking to transition out, if they did not take the DSO model, have just taken the model of, we want to put a young doctor in and not mentor them, and just basically say, we want you to end. Maybe you get all the cases that are not so great, and maybe you do the things I don't really want to do, and when there's something that's very profitable, I'll come in and take that. And we hear that from a lot of young associate doctors who've gotten out and have maybe been in practices, private practices, where they felt that there's not that mentorship. And it's kind of a shame that the DSO might provide better mentorship than private practice. And I know there's obviously tons of private practices that provide great mentorship.
Absolutely.
But I think DSOs have said, hey, this is a good DSO, which I think most of them understand this. There has to be mentorship in order for that business to grow. That's just good business. And but I suppose if all you care about is the next year of your life, you say, I don't care, we'll just be out of here. But the DSO knows, hey, in order for us to be successful, mentorship is critical to that. And I think young doctors are getting out knowing that. As you say, if they only did 7 crowns, they need some mentorship.
Yeah, I mean, in some, they are confident. Number 8 is my best one ever, and I go from there.
Right.
They will do implants if they're straight or not. It doesn't matter. They just don't have that level. They are somewhat careless and aggressive, and it will come. And others are more, and I was more that type. And in Switzerland, we didn't have postgraduate programs, so you went into private practices, and you knew exactly who the good mentors are. So you signed up 2 years with somebody cosmetic, and another year with somebody dentures, and that's what I sort of imagine. These people need to be around to take care of those young dentists who just didn't have quite enough experience in their education.
That's right. That's right. And I hear that, again, good DSOs are able to they've realized that. They understand that. And I think there's no end in sight to the cost of education going up. And so knowing that, there comes a point where people have to do something with that.
Right.
And
it's interesting too. I recently heard a presentation of Marko Vujovic from the ADA, and there is a few dental schools. He showed percentages of dental students coming out of different programs, going into DSOs or groups or solo. And there are certain dental schools, the newer ones, the recent dental schools, they are almost directly affiliated
with the DSO.
With DSOs
Yes.
and feed the DSO.
Right,
Yes.
right.
And that's I feel like that's coming because if you come out with $500,000, you have to have a job.
Educational debt is not sustainable, right? Especially, we've embraced women in our community, and dentists have embraced that women can bring so much to patient care. And now, greater than 50% of the people in dental school are women in the United States. And I think that's fantastic because women do bring something to the table when it comes to the chairside demeanor, the care that they give. They have a certain facet that just brings a different personality to it. And I like that. Yeah. And I think that for those that are coming out with this surmountable debt, the DSO could be a great place for some people that don't want to work, 5 days a week, 4 days a week, even 3 days a week. Like yourself, you've said that, I want to work, and I want to be in a place where it's fun, but I don't want to have that
flexibility.
management. So for women, this could be fantastic too. Or a man that doesn't want to work full time.
Right. Either way, having that flexibility to make decisions for your family life, for your personal life, as well as your business life, and having it to be
work-life balance.
That's right, more of a balance. And yet, I think too, what's more exciting for somebody in your world who you've been at a high level doing great dentistry, you're coming at it from a whole different world. Yes, it's some balance, but it's also you're getting to do fun things. You're getting to have fun and treat patients, and get compensated for what you know, and that's something that at the quote unquote end of your career, toward retirement, you're not just saying, well, I've just got to get rid of all this. You can stay in that fun environment and get to be pushed and challenged and all of that.
I think as business changes in the United States and across the world, retirement is going to be a different thought process. And I'm excited for the future. And I'm excited that you came on to be able to discuss this topic. I know you're going to be presenting here this afternoon, and that's going to be fantastic. Tell us a little bit about what you're presenting.
Yeah, pretty much of what we discussed here on the advantages and disadvantages of being in a DSO affiliated practice. And I will show a lot of the need. I mean, that was my motivator. To see all those people in need who normally wouldn't be able to afford it. They pay a fortune in there. I mean, it's a lot cheaper or less expensive than if I did it in a regular private practice.
Because of the scale, you're able to offer an affordable option that is really just amazing.
And I have examples where patients with destroyed dentition because of periodontal disease, they went to a periodontist of prominence, and even the periodontist has to say teeth out, implants in, $120,000.
Yes, exactly.
And he said, I can't afford that.
Yes, right.
And so he said, actually, go to Quincy.
Yeah.
And the other thing,
we can do it for maybe 2/3, less than two, a little more than half of that.
Right.
And then with helping with financing and all that, it becomes affordable for a certain number of patients.
It's an amazing service. It really is.
And DSOs are also, as we kind of close out there, because you've always been involved in research, DSOs are providing another interesting niche, which is because they're consolidating a lot of patients and cases. There's a lot of data. And I'm starting to see that feeding back. Because Ole Jensen was... for years, a lot of the data that he was presenting in journals was coming from a DSO. And that's another
actually
place.
Will be my next role. I will reduce practice to 2 days and will work with Steve Eckert at CCMS in the research group.
Yeah, fantastic.
That I can do from home.
Oh, yeah, that's right.
Nice.
Work remotely,
so
right? Yes. Kick up the feet, drink the coffee, right?
Well, we're looking forward to hearing your talk this afternoon. Thank you for being with us and kind of sharing your knowledge, and it gives us a lot to think about, a lot of our listeners to think about as far as what their practice choices should be in the future. So thank you very much for your time.
Thank you for having me.
Right.
It's great.
Absolutely.
Yes.